We're hoping that other people gain inspiration from this process. And when they see, oh, so if someone my age can do this, then I can do the same.
My nephew said to me, Auntie, if you could just picture filling an entire auditorium of people, that's how many people you've helped.
My dad was in line getting his second vaccine, and he's like, it was really strange because the two ladies behind me, you had helped. And he's like, I turned around and was like, oh, that's my daughter. Megan and I have known each other for over 40 years. We were both born in Sterling, Mass, and have been friends ever since.
We've known each other for our whole lives, basically.
Megan Marshall and Kristen Nelson are two moms seeing their parents struggle to sign up for the vaccine. What they said to me was, once we saw our parents struggling, we knew it wasn't just them.
My mom was in the first wave. I booked her an appointment, but then that senior center rolled out a whole vaccine clinic for our whole elderly population. So I actually had to cancel my mom's appointment. And through that process, I was thinking, who can I get in there in her spot that doesn't live in the town? And I called Kristen and said, wow, there's a lot of availability locally. How can we book people? I started scrolling through my phone and thinking of everyone in that age group, right? Parents of my friends from my childhood.
That was that age group, 65 and older. For all of us reporting on the vaccine registration rollout, we were so surprised that there were so many hurdles, but it wasn't surprising that you have average Joes like Kristen and Megan stepping up to the plate to help. It was one of those things where you had to dive in and get your feet wet to figure out how to do it right.
We know that you have to press refresh 132 times. So much so that one time the site blocked my IP address because they thought I was a bot.
What are the good days? What are the times? And then you learn there's such nuances in the sites. We've learned all these little tricks that the average user just booking one for themselves or their loved one is not going to know. It sort of took off and grew by word of mouth.
In the first 10 days, they were able to help 125 people sign up for the vaccine. They just started getting dozens of names and then calls from strangers and messages on Facebook from people they didn't even know.
We've booked as far away as Georgia, Virginia, Kentucky. Sometimes they even say, I don't know who you are or why I'm calling you, but my friend told me that you could help me.
We had not had the opportunity to see each other a lot during the pandemic. So this is what brought us together. Kristen and I are the kind of friends who might see each other twice a year. What this has done is it's just brought us so much closer. It sort of reminds you the value of those solid childhood friendships that are few and far between.
You tend to collaborate well with somebody that you've known your entire life.
Kristen is better on the phone. I'm really good at keeping up with the inbox, keeping up with spreadsheets, but I'd say, honestly, it's a real shared job. I'm an attorney for a global consulting firm, but I specialize in healthcare. So this is right up my alley.
And I'm in education. I work in residence life at Worcester State University. That's the best part about this, besides helping people, has been being able to use both of our strengths together, really for the first time.
I come from a family who all work in healthcare. My mom dedicated her career to healthcare. My brothers are all frontline workers. And I felt like I had no role to play. I had no contributions I could make until this happened.
Both women work 9-to-5 jobs, have children, husbands. So they were taking time outside of their jobs, sitting down at a table with their computers and their cell phones and getting to work.
We find the time, early morning, late at night, and all weekend. I was driving to Logan Airport at 5:30 a.m. My husband was driving and I was on the internet trying to book appointments. We're both super goal driven. So if someone gives us a problem, like I can't get out of my house to get a vaccine.
Or I'm a veteran in Georgia and I can't find a vaccine, nobody's helping me.
We're gonna figure it out. And that's just who both of us are.
I remember them saying to me, we'd get phone calls from people and just the relief that we could hear in their voices was enough for us to keep going after the first couple of weeks of doing this.
I spent one night on the phone with a woman from a local town, probably 45 minutes. She hadn't been able to see her grandchildren in over a year, and she's been lonely. Her husband passed away 2 years before. And she really made me realize that's why those phone calls are important.
One of my dear friends is going for a kidney transplant, and her donor needed a vaccine before they went into surgery next month. My friend reached out to me, and in that moment, a site was open. So I got her donor in this week. Really good husbands and really
Awesome children.
And understanding children has allowed us to do that when it was new and it was really hard to get an appointment. I mean, we were just working like every single night till 10 o'clock at night, morning at 5:30 a.m., all weekend long. I'm so thankful that I have a great supportive family who just sort of took over, cooked dinner, helped with the kids' homework.
Our children actually are the ones who reached out to the news to say, our moms are doing this and we want somebody to give them a high five because they're literally spending all day doing this. And that was just so nice to see that they noticed. Sometimes your kids don't know that you do real things in life.
When their daughters emailed us, the word they used a lot was rock stars. They're rock stars in our community.
My mom, she's always been like an inspiration to me.
They're teaching us to just keep going and help others and like do what you can. Small acts of kindness matter.
I think we're up to about 450 booked appointments. It's been amazing. Just totally incredible, especially getting the stories back from people that they get to travel to see their first grandchild being born.
Knowing that they contributed to that person having a glimpse into freedom, going back to some sense of normalcy, that was so special to these women.
I have one, they were been fully vaccinated for 2.5 weeks now because we helped them at the beginning. And they flew out this morning to see their son who's been in chemo treatment for 15 months. And so it's the first time that they've been able to get out there and feel comfortable being around him.
My nephew said to me, Auntie, if you could just picture filling an entire auditorium of people, that's how many people you've helped. And it just really struck me because I hadn't stopped to think about what that volume looked like. And he was like, you have no idea. That's so many people that you've helped.
I thought, I want to help humanity. I want to help everyone in the best way that I can.
Kevin Manchotti is a 13-year-old boy. His father, Dr. Manchotti, reached out and he told me this story of how his son had this grand idea to help out senior citizens who may not be able to get to their vaccination appointments.
I always saw my father going to my grandmother's house and treating her. She can't do many things on her own. So I thought that if there's other seniors like this, how are they going to go drive themselves to the vaccination centers and get vaccinated? I always see on Facebook that a lot of GoFundMes have been successful, so I thought I should give it a shot and see how it would work.
He was able to raise $9,600, which is amazing.
We were trying to figure out how to navigate the money. We reached out to the local hospitals and also to the public health officer, Dr. Park, who was very willing to help Kevin.
I'm so proud of Kevin and I'm so impressed. And it's an idea that we can really apply in real life. It's really going to help some people, and I believe it will actually save lives.
Dr. Park's idea was that when they do call the few numbers at the county to get appointments, they will give this phone number to them if they need transportation. And this phone number then would go to the dedicated line through our practice, which only deals with the vaccination. As soon as we heard that there's availability of vaccines to help the community, we got our paperwork in and we were able to be successful in securing vaccines for our community.
If they do need any transportation help, we send them a voucher through that same number, which would cover the cost of a round trip within San Joaquin County.
I wanted to see the ride shares in action. It was awesome to speak to Evelyn, who, if it had not been for Kevin's efforts to raise money and get ride shares together, she wouldn't have been able to get these vaccination appointments.
Great, especially for us, the senior citizens, it was really great.
Driving by myself, I didn't really want to do in case I had any after effects.
So Miss Dion is actually a patient of Dr. Manchotti's. Through Kevin's rideshare voucher program, she was able to get to and from her vaccination appointment.
Being 13 and thinking about others is quite impressive.
It makes me feel that I've done my job right as a parent, and of course my wife also.
I wanted to be like my father, helping people, saving lives.
From a very young age, he looked up to his father because he is a cardiologist. He's also an immigrant who was able to study hard and become a doctor. In turn, just to see how much Kevin has put into giving back to the community, Dr. Manshadi drew inspiration from that.
We probably are several hundred to almost 1,000 vaccination already just at a solo practice. We came up with a process where we had a long wait list. Nothing was wasted on even one shot. We did realize that there's some inequities as far as vaccination.
At the time, less than 3% of the Black population here in California were vaccinated.
Just being in the Central Valley, we already have large population of Hispanics, and they had a very high death rate also. So we were able to get a significant number of them also vaccinated.
So we also, started talking at virtual town halls. We worked with religious groups and other community leaders who are trusted within San Joaquin County.
I'm just happy that everyone was able to work together as a team and help the common good.
He volunteered at the vaccination center where he would come and sit and monitor patients after they had the vaccine in case they would have any reactions.
And I've noticed that a lot of the seniors, they were all very joyful because after all this time and all the stress from COVID-19, they've been relieved with the transportation vaccination.
I mean, he's an amazing student. So he wants to follow in his dad's footsteps.
Obviously, I can't be a cardiologist like him right now, so I thought this is probably the best way I can help humanity and save lives as well. Since this process reached its peak, we've been able to transportate about 80 seniors.
You don't need to be a 13-year-old whiz kid in order to help someone. It doesn't end with him. It may start with him, but we can continue that effort and help even more people.
We're hoping that other people gain inspiration from this process. And when they see, oh, so if someone my age can do this, then I can do the same.